Thank you again for connecting with today's The Reframed Brain podcast episode. This is Erica Savage, the founder and host, extending a personal invitation for you to join our community where you can receive my 5 best brain health tips and a playlist curated with you in mind. Please go to thereframedbrain.com. Thank you again and be well. Well, happy Monday. Today is June 5th, 2023. I am Erica Savage, the founder and host of the Reframed Brain podcast and wellness community. And I am also the author of the #1 new release, A Southern Girl's Green Thumb, 9 easy care plants to add to your space, available on Amazon right now for $9.99. I am so happy that you are joining me on the second half of the year on this first Monday in June. It is so interesting to look at just how fast 6 months have gone by. But as I often talk about in regards to our health, it's always a perfect opportunity to reset, to add new practices, and to add new principles. If this is your first time connecting with the Reframed Brain, I'd like to welcome you. What I do on the first Monday of every month is I offer 5 easy and then fill in the blank. So, welcome to this edition of 5 Easy. For this first Monday of the month, for this month of June, we're actually going to be focusing on what it is specific to men, and that June is National Men's Health Month. So, I want to focus on 5 things that we all need to know around National Men's Health Month. You know, when we think about life expectancy specific to non-Hispanic Black men and other men of color that has decreased over the years, specifically since the advent of COVID-19, is really, really important to really wrap our arms around ways in which men and those that identify as men in those communities can really ensure that they have better health outcomes. So I hope that the focus of this particular podcast episode, whether or not you are men, but if you are in community with men that you love, young men and boys, there are things that can be modeled and demonstrated in order to help, number one, prevent those outcomes from being generational, but then also to really make lifestyle choices, better lifestyle choices to improve on those life health comms. So I'm laying out 5 things that I think is important that we know around men's health. So we're going to start on some things that are a little bit more demonstrative, and then, as always, end on a positive note. And if you are new to the Reframe Brain audience, if you go to the reframebrain.com, there you can get our 5 best brain health tips that come to you at no cost, and then a playlist that is curated with you in mind. If you are watching us via YouTube, thank you so much for watching, and thank you so much for listening. Please do subscribe, and then also add a comment, because this is an interactive community and your comments will be responded to. We really do like conversation. And then if you really, really, really want to engage, listen, when you sign up on the reframebrain.com, after you get those 5 best brain health tips and that playlist that is curated with you in mind, what you're also going to receive are weekly newsletters every Monday of the month. If you have heard me talk about anything, you know that Monday is one of my favorite days of the week. That is why the podcast is the first and third Monday of the month. The third Monday is when we have a featured guest. Last month, for the month of May, we had Dr. Mustafa Ali, who is phenomenal in the work that he does. Please go back and watch and listen to that if you haven't. And then also, this Monday newsletter is a Mindset is Greater Than Monday newsletter. Really short, quick to the point. And I think it is definitely something that is beneficial for you. So please do make sure that you signed up on the reframebrain.com. And if you're listening to us on your favorite podcast platform, thank you so much for listening. And if you don't mind, would love if you would please leave a review so that we can make sure that this podcast does extend to other people in wider communities and goes around the globe. So again, June also being National Men's Health Month, Here are the first of the 5 things that I think it's important for us to know if you're a man, if you're in community with men and with boys. And that is this. And everything that I'm sharing with you, these are backed with statistics, and they come from verified and sites, which are sites with which people research. They are authenticated sites. So the Office of Disease and Prevention of Health, the Office of Disease Prevention and Health Promotion talks about men experience poor health outcomes, and this is specific to non-Black, non-Hispanic Black, and men of color due to a few things, but I wanted to highlight these 2 specific things, one of them being race, and then the other one being social determinants of health. And this is how the Office of Disease Prevention and Health Promotion defines social determinants of health, if this is a new term to you. It says, and quote, the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And so let me talk about some of the examples of this that were included by this specific office. Safe housing, transportation, and neighborhoods. Those are all safe things that they include racism, discrimination, and violence, education, job opportunities and income, access to nutritious food and physical activity opportunities, polluted water and air, language and literacy skills. So these are all examples of, again, social determinants of health. And so when we think about the latter piece that was mentioned specifically around language and literacy skill, it's really important to note this for non-Hispanic Black men and men of color, that they are impacted more significant in literacy levels according to, here's another institution, the National Center for Education Statistics, experiencing, quote, the lowest literacy levels. Okay, this is from the National Center of Education and Statistics. And why this is important is because these low levels directly correlate with health information dissemination and understanding. So when we think about actually understanding the information that's being passed along that do impact health incomes, that you have non-Hispanic Black men and men of color that have, again, according to the National Center for Education Statistics, the lowest literacy levels, and that is a social determinant of health, then we understand why we've seen the impacts of disinformation on Black and communities of color that lead to the third point, which is non-Hispanic Black men and men of color suffer, and listen to this, disproportionately from disease and higher death rates, with these 3 leading causes of death. Now, this is information that was pulled, of course, from 2016 to 2020. And this is according to the National Cancer Institute, that the 3, that 65% of non-Hispanic Black men and men of color are more likely to have cancer than non-Hispanic white men, and twice as likely to die from it. I definitely need to repeat that specific from the National Cancer Institute. 65% more likely than this, and I'm quoting this, quote, 65% more likely to have cancer than non-Hispanic white men, and twice as likely to die from it. So then when we look at the leading causes of death for non-Hispanic Black men and men of color, it is heart disease, and that's the 2016 to 2020 data that I was referencing earlier, heart disease, cancer, and COVID-19. That third, COVID-19, had been replaced, well, unintentional injuries was the third leading cause of death. That has since been replaced by COVID-19. So when we're thinking about social determinants of health, when we're thinking about the lowest level of literacy rates when we're thinking about disinformation, and we're looking at the leading causes of death. And then we're looking at where non-Hispanic Black men and men of color are leading with regards to cancer. These are things that definitely having more information, knowing these numbers, knowing this information would help us with what my fourth point is, which is prevention. And so I said that we were going to start a little bit heavier because I wanted to first give us the information that is definitely steeped in institutions of research and data. However, then make sure that we anchor this with what the good news is that prevention is a great tool available to live longer and healthier through these few things. Exercise. If you're exercising at least 2.5 hours a week, about 30 minutes a day, and this exercise, moderate exercise, according to the Heart Association, moderate walking is just as good as any other forms of exercise. Because what you're also doing with the moderate walking is that you're also out in nature. And so the mental health is boosted as well. Your senses are activated because perhaps you are in an environment where there are birds that are moving about. Perhaps you're in an environment where there are trees. You're actually hopefully in a space where the air is quality air and not one of those social determinants of health where the air is polluted. So exercise 30 minutes a day. So again, walking, thinking about the leading cause of death being heart disease, and not just exercise, lifting weights, but to include walking. So thinking about moderate exercise, swimming. A significant share of non-Hispanic Black men and men of color do not know how to swim. There is a transgenerational fear of water for some, but actually learning to swim and actually swimming is great for the heart and it's great for the body. Eating fresh fruits and vegetables every day. So if broccoli is something that you enjoy, broccoli is something that can be cooked relatively quickly. And it is really, really good, especially when it's steamed freshly, not salted, buttered down, peppered down, but actually holding its nutritional value. It's something really, really good. And fresh fruits, things that really aren't over salted, are not very sugary. And if you are a person that is diabetic, you definitely want to contact your primary care physician to make sure that you balance how much fruit that you actually can ingest, because those do have their own natural sugars. Discontinuing tobacco use. When we're thinking about, and I know that there are men and women alike, but because this podcast episode is specifically focusing on National Men's Health Month, when we think about sometimes men gathering and perhaps drinking, having alcohol and smoking cigars together as a way to connect, not making that something that is a lifestyle, but something that is done, not as often, but just to let it be known that tobacco use is something that is harmful to the body. Everybody that uses tobacco does not develop cancer. But when we think about non-Hispanic Black men and what the data shows us specific to heart disease and the contributing factors around heart disease, that discontinuing tobacco use or not making tobacco use something that's frequented, and that's cigars, cigarettes, all those types of things that have tobacco in them. And making sure that annual checkups are scheduled and that they are attended. And also with that, making sure that blood work is done. And when that blood work is done, that you're also scheduling to get the readout of those numbers, making sure that you're actually taking notes, that even if you don't understand the language, letting your physician know, I need for you to slow walk and let me know what this is, what this panel is, and what these numbers mean, and what they should be for someone like me. If you are a non Hispanic Black man, a man of color, and what that looks like across your specific ethnic group, and what that should look like. Um, Also, performing, women are encouraged to do self breast exams, specifically to help with early detection. That the threshold for age of breast exams has been lowered because Black women, the rate of death has been climbing. So, for men, specifically the groups that we're discussing here, to make sure that you are also doing self exams for testicular health, to make sure that that is something that you are doing monthly as well. And then the fifth thing and the final thing for this particular podcast episode, in honor of National Men's Health Month, if you are a father, we want to go ahead and begin to celebrate you now here at the Reframed Brain podcast and tell you Happy Father's Day, and also to give yourself an early Father's Day gift. So, the tools that I named for prevention, the gift of life, those things are wonderful gifts to give yourself, but also the gift of healthy connections, and specific healthy connections, other brothers, other men that you can connect with, where the conversations are positive and uplifting, not negative and demeaning, but really good connections, because men should also nurture and emotionally invest in one another. That is not something that is gendered. That is something that we should all be doing for ourselves, but then for one another as well, because love and support are action words. Men's Health Week specifically is June 12th through the 18th. So if you are a man, I am going to issue you a challenge. And that challenge is to text a man in your life, I love you and I appreciate you. All right. All right. So thank you so much for connecting with this episode of the Reframe Brain podcast, specifically highlighting National Men's Health Month. If you are a man, I would love for you to pass along this podcast episode to one of your other brothers. You all have good discussion around this episode. Meeting up and connecting with other men and having really good conversations is one of the elements that is key to long life and longevity, because we were not created to be an island unto ourselves. And if you're a woman, whomever you are, you're listening to this, please do share this episode with a man that you admire, love, or you believe that can, and or you believe that could benefit from this podcast episode. So thank you again for tuning in to the Reframe Brain podcast, where we center brain health and unseen injuries. It was my pleasure to bring you these 5 things, and I will see you the third Monday, which will be Juneteenth, with our special guest, Tanya N. Sloan's Esquire. Thank you so much. Happy National Men's Health Month. Be well. Bye-bye.
Thank you again for connecting with today's The Reframed Brain podcast episode. This is Erica Savage, the founder and host, extending a personal invitation for you to join our community, where you can receive my 5 best brain health tips and a playlist curated with you in mind. Please go to thereframedbrain.com. Thank you again and be well.